So I found something that is really helping me with my stomach problems that I've had since taking the antibiotics almost 11, 12 months ago. And what it is it's actually called a FODMAP diet. Now, FODMAP are basically these types of sugars, that are found in fruits, vegetables, whole grains, things like that. And it's a very specific list, okay, that Monash University from Australia came up with to help IBS patients and people who have digestive disorders like Crohn's, ulcerative colitis, SIBO, to avoid in order to get relief from their symptoms. Now, it isn't a lifetime diet to stay on forever, but really for 6 to 8 weeks to help manage the symptoms and then reintroduce, one food at a time and see if you can tolerate it or not. If you can't, then you can go back. But it is a scientifically backed, backed diet, so there's science behind it. It actually does work. It's been proven to work. So anyways, I've been doing it for about a week, not quite yet, and within the first day and a half, I'd say, I had some major lessening of symptoms, and right now, I feel pretty good. I'm saying it isn't hard really to follow this diet. You gotta buy a little bit more expensive foods, like if you want to eat, more normally, I would say. But for the most part, it's really relatively easy to follow this diet. You don't really have to give up too much. You gotta avoid gluten. You gotta avoid dairy. Those are really big, I think, when wanting to overcome any kind of digestive problem that you might be having, is avoiding wheat and gluten and dairy. Those foods, even if you don't have an allergy to them, I notice, with myself at least, that I always feel better. I tend to be thinner, and my skin seems nicer. So it's just, overall, I think most people are best off just avoiding gluten and dairy. There's alternatives. You can drink rice milk, coconut milk, almond milk. They got coconut milk ice cream. They got gluten-free ice cream cones. It's not like, it's the end of the world. There's great alternatives out there that are much healthier for you, and a lot of times they're GMO-free too. If you have to pay a few extra bucks, it's worth it, I guess, for your health. So check out the FODMAP diet. I'll put the links down below in the description box. You guys should really check it out because, if you're suffering with constant bloating, constant abdominal pain, you don't know really how to describe it, you're going diarrhea, you're having constipation, any of these symptoms, try out the FODMAP diet because it's really, I think, helpful. And another thing is, in my case, I believe that I probably have a small bacterial overgrowth infection, also known as SIBO. And there's many reasons why you can get SIBO, but there's these motor complex things in your intestines that help to move things from your small intestine to large intestine, while antibiotics, certain medications can damage those motors. I think that the motors may have got damaged when I was taking a month long of antibiotics. And maybe that's kind of how things got messed up. I probably have some dysbiosis, probably have some candida. I've been taking extra coconut oil every day, which I think is really helping me. And I was taking a 90 billion probiotic supplement from Ultimate Flora. And as soon as I started taking that, I was just getting diarrhea really bad. So I did some research online, and I found out that a few other people had the same exact side effects when taking 90 billion probiotic from Ultimate Flora. I think it's probably because if you have SIBO, you probably don't want to be feeding the bacteria more with more bacteria. So in probiotics in this case, probably a bad thing. It probably will make your symptoms worse. Or an alternate explanation is maybe you're having a Herxheimer reaction. Okay, it's your body's way of cleansing. So the bad bacteria are dying off, the good bacteria are taking up residence. But I do know that once I stopped taking them, my symptoms greatly improved and I stopped having diarrhea. So I haven't been taking any of the probiotics, and I don't think I probably will. Usually they say with SIBO is first you want to get on the FODMAP diet to starve the bacteria. You can also get on the specific carbohydrate diet or the GAPS diet, which is also good. But FODMAP diet is actually scientifically backed, and you will find relief of bloating and a lot of your symptoms by following it. So you get on that, you start following the FODMAP diet, and then you can start taking antimicrobials. You can take oregano oil, you can take grapefruit seed extract. There's different, vitamin basically complexes with these different antibacterials in them. Golden seal is one. You can take coconut oil, because it helps kill parasites, worms, whatever might be going on in your intestines. It also helps to heal your digestive tract, helps to give relief from serious digestive disorders like Crohn's and colitis and things like that. So coconut oil is fantastic. And then once the bacteria are starved, and it's been a while and your symptoms seem greatly improved, then you can bring in the, good guys back in, the probiotics. I haven't got to that stage yet. I still have a long ways to follow with this, but, and Dr. Mark Hyman is a great functional medicine doctor, and, he says that this one patient that he had, she was just a mess, she's having IBS really bad and all these symptoms, and he basically had her go on a gluten and dairy-free diet, and, checked her out for SIBO, helped kill the bacteria in there, and then 2 months later she came back like a brand new person. So really 2 months is a good, time to avoid gluten, dairy, stick to the FODMAP diet, take some of these antimicrobials, and I bet you anything, if you do that, your symptoms will greatly improve and life will be much more enjoyable. Because believe me, I had constant bloating and pain for like almost, a year now. And, I had some tests done, couldn't figure it out. So I'm still waiting on some blood work that I'd taken, but I'm feeling pretty good. And I just wanted to share this to help anybody else out there that is suffering with this. I'm sure I'm not the only one because, doctors, dentists, they hand those antibiotics out like candy, like nobody will get sick from them, but that's not the truth. The truth is they'll really mess up your ecosystem in your gut. And once that ecosystem's messed up, man, you watch out because you get symptoms like left and right. So, take care. If you like the video, please like and subscribe. If you have any questions, ask me, and see you later.